So thank you everyone for joining today's webinar. This is a webinar on commercial determinants of health and country case studies. Our speakers will explore health effects of harmful commodities through case studies. This is the second webinar from our webinar series from the Center on Commercial Determinants of Health, which is supported by the George Washington University Seminar Series program. This webinar is also conducted and held as part of the 2020 Global Week for Action on Non-Communicable Diseases, NCDs. Before introducing our speakers and jumping into the presentations, I would like to go through some, quickly through some logistical questions. Please submit all your questions through the chat box, and our coordinators, our people will be monitoring, and we will be answering as many questions as possible during the Q&A. And I would just request that everyone please identify yourself with first name, last name to make sure that we have real people. And then I think everybody's microphones are automatically muted. And those who are not speaking, please could you just mute your microphones? We will unmute only those who will be presenting one at a time. Okay, perfect. So today I have a pleasure of introducing two great panelists that bring wealth of knowledge and expertise in the field of commercial determinants of health, and will speak about two different commodities in two different settings. And I hope this is going to be an interesting discussion and interaction. First, let me introduce Dr. Gopalakrishna Gururaj, who is Senior Professor in the Department of Epidemiology at the National Institute of Mental Health and Neurosciences in Bangalore, India. Dr. Gururaj leads the WHO Collaborating Center for Injury Prevention and Safety Promotion and Center for Public Health and National Institute of Mental Health and Neurosciences. His work includes epidemiological and public health research, policy analysis, public advocacy, monitoring and evaluation in a wide range of topics, including unintentional and intentional injuries, social and commercial determinants of health, and mental health. He has undertaken several road safety research and evaluation activities in Asia, India, Middle Eastern countries, and has won numerous awards in recognition of this work. Dr. Gururaj will speak about alcohol availability and public health impact in India. Dr. Gururaj, please.
Thank you very much, Dr. Nino. Good morning.
Ben, Imran. Yes, sorry. Could somebody share his slide, please? Okay. It's all yours, Dr. Gururaj, sorry.
Okay. Thank you very much, Dr. Nino, and good morning, everybody. And I would like to thank the team for giving me this opportunity to join this webinar and to share some experiences from the Indian region with regard to the availability and public health impact of alcohol in the Indian region. Basically, apart from all the other determinants, the political, the social, the economic, and the cultural determinants which impact health, the commercial determinants are one of the major factors. And there are many products in recent years that we have come across that have a huge impact on the health of populations. And among the several ones that we have witnessed in recent years, alcohol is one of the most significant one, because it has its impact on several dimensions of people's lives, as well as on the economy, culture, and the societal life of people. Basically, India is a very diverse country, as many of you are aware. It's a huge country with a population of about 1.3 billion, spread over 28 states and 7 union territories. The population is very diverse in every aspect, not just in the income levels, but in the culture, lifestyles, in many other areas that are characteristic for India. In the Southeast Asia region, India is one of the most populous countries, and it is governed by a republic of the government of India, which has a major say when it comes to several policy aspects of alcohol. But because we have 28 states and 7 union territories, each of the states also have equal independence, and their judicial rights when it comes to the making alcohol available in the society. Next one, please. Uh, b- I mean, this is a very well-known thing, how much globalization, industrialization, and all have affected people's lives. But among the several ones, the increased availability and social acceptance and the growing consumption of alcohol is one of the major factors. Over the last 3 decades, the Indian region has seen a greater availability of alcohol for a variety of reasons, and I will quickly highlight some of the important ones. But at the same time, because of the growing young population in the country, the acceptance of alcohol has also become much higher, and the consumption has increased phenomenally. India is one of the countries wherein its constitution stated very clearly that alcohol is going to be prohibited. But since 1947 and by 2020, we have seen a situation where alcohol is sitting on the dining tables of most families. And that's one of the ways by which we can summarize the increasing availability of alcohol. But at the same time, the alcohol use has impacted the health profile of the whole country. And because along with the epidemiological transition and the socio-demographic changes, alcohol use contributes for a major percentage of non-communicable diseases and injuries today. Next one. This is one of the very recent studies done in India, which tracked the prevalence of current alcohol use, and it shows that nearly 14.6% of the population consume alcohol. The prevalence of alcohol is to that, and it's substantially higher among men, going up to 27.3%. At the same time, if we see the prevalence of specific alcohol use disorder, as we examined in our national mental health survey in recent times, it shows that there is a 4.6 to 5.2% prevalence varying across the states. But what's interesting is also there is a huge variation across Indian states. We see that in some of the union territories to a very low extent to as high as nearly 60% in some of the northeastern states. And in between, there are states which contribute to varying levels, and that makes it very interesting for comparison within the country as well as for comparison across many other determinants. In addition, the alcohol availability has to be examined at 3 levels, specifically in India. One is what is the reported alcohol. The other is imported alcohol, which is included within the recorded and the reported category, as well as the unrecorded alcohol consumption, for which I'll come to that in a minute's time. Next one. The trends in alcohol per capita consumption over the last 3 decades is shown here. We have seen a huge increase in the alcohol per capita consumption between 1990 to 2017, and it is projected to increase by 2030 in a substantial manner. The per capita alcohol consumption among men aged 15 years is about 5.7 liters, whereas among those who specifically consume referred to as drinkers, it can go up to 14.6 liters. What's most interesting is that the consumption has increased by nearly 40% during the last 10 years itself. And mainly the pattern of alcohol consumption also differs in India, and majority prefer to consume hard liquor, uh, which is nearly 60% of them preferring for country liquor or spirits. Next one. When it comes to specifically alcohol, as I mentioned earlier, the Constitution of India had prohibited alcohol in its written documents. But over time, what we have seen in the country is that alcohol is prohibited in 4 states and one union territory of India, while it's available in the remaining 25 states and 6 union territories. But even those states where alcohol prohibition is present, either total or partial, there is availability of alcohol. And for a variety of economic and social reasons, the prohibition in alcohol has been difficult to maintain and difficult to sustain. for both economic reasons as well as for cultural reasons. So that makes alcohol freely available across the country, where it can be easily procured as well as easily consumed due to changing lifestyles of people. Next one. This shows in that respect the changes over the period 2010 to 2023, and India is the third largest alcohol market worldwide, with a huge market size of nearly 35 billion US dollars in 2017 and likely to double by 2020. And this is something for which we are waiting for the latest figures to be available. Next one. And this shows the volume of alcohol in the Indian market, which has almost doubled in the last 10 years. And that shows it that alcohol is so easily available in India because of the open market economy and the liberalized economic policies, as well as the lifestyles of people. Next one. Uh, to sell the alcohol, produce alcohol, one needs to procure a liquor license from the respective states through their excise department. And this is not a very definitive data, but some data that is available through different sources indicate that there are nearly 10 million retail outlets and about 500,000 bars that make alcohol available to the population. And the density of these alcohol outlets, they vary across Indian states, uh, ranging from as little as 5 per lakh population to as high as about 60 per lakh population. And this is very difficult to get information because even though alcohol outlets are licensed and had to be controlled by the respective state governments, the precise numbers are hard to obtain. Next one. Alcohol is also available for most of the hours in a day, even though there is a difference in the trading hours that vary across states. In some states, it's available to 11 p.m., in others up to 1 a.m., and on different days, different outlets. But what's more interesting is the growing influence of the alcohol industry, as well as the changing policies of the government, which now makes wine and beer to be sold in supermarkets. In some of the states, the malls and pubs are available for nearly 24 hours a day, and e-commerce permission is being provided. So all these different policy directives of different state governments makes alcohol easily available. Next one. The minimum purchasing age for alcohol also differs across Indian states, and there is no uniformity in this, which varies from 18 years in one state to 25 years in another state. And on average, most of the states put it at 21 years. There are also restrictions with regard to alcohol consumption in the public places. They are banned in some of the establishments like healthcare institutions, education institutions, public transports, public parks, and others. But the challenge has been in implementing these things across different states because of the poor regulations, as well as the difficulty in enforcing this at the time of sales as well as at the time of consumption. Next one. Uh, there are few days that are in which alcohol is not available, but many other Indian states also have fixed up different days in which alcohol is not available, and they are considered as dry days. The states have also set their legislations not to issue license if a premise is located at a particular place. Recently, the Honorable Supreme Court of India, 2 years back, issued directions that alcohol should not be available within 500 meters of any national or state highway. Uh, Next one. There are, in addition to all these policy directives that are not stringently implemented, there are also efforts to promote alcohol through a number of ways in the Indian region. And this can be through different surrogate advertisements, sponsorship of sports and other events, promotion of healthy alcohol, advertising campaigns on pin size victories. These are all new initiatives that are coming up, which promote alcohol, especially targeting the young population of the country. We have nearly 600 million people who are in the age group of 15 to 34 years, and they are the prime target audience when it comes to sale of alcohol. Next one. These are the few other examples where alcohol is also virtually made available through mobile apps, through ladies' nights, common social media platforms, through films and celebrities endorsements. And recently, there is a corporate social responsibility activity that is taken up by most of the industries, and where the responsibility-driven programs are also encouraged in a very big way. Especially in the field of road safety, we have a few campaigns that go on regularly, which bring in some celebrities as well as drive home the message that drinking is your own responsibility and is not the responsibility of anyone. So there are a lot of new avenues that have come up through which alcohol is sold to the population uh, by and large. And this makes it very complex situation to manage alcohol control and also manage the increasing burden of alcohol related problems in the Indian society. Next one. With regard to advertisements, they are very, very lax regulations. We have several to specifically certain advertisement codes when it comes to digital and print media. But at the same time, the social media is a highly uncontrolled platform on which there is no control of anyone. And that's being used in many different ways to promote sale of alcohol. So there are other stipulations like warning labels on alcoholic beverage bottles, but these are present but not strictly enforced in a given situation. Next one. Taxation and pricing is considered as one of the best buys when it comes to control of alcohol. And it's a very well acknowledged strategy recommended by WHO and other agencies, as well as tried out in many high income countries. Considering the price elasticity of demand for alcohol, it's considered modest in nature in the Indian region. It seems more favorable for the hard liquor, so that the cost of per ml of pure alcohol for whiskey is much lower than for beer. So, and this is very important because in the Indian region, nearly 5 to 20% of the state revenues, they come from alcohol taxation. And this is a very challenging situation in that manner to see how this can be replaced with other economic revenues, so that the dependency on alcohol taxation and pricing can be managed much better. Um, in reality, even though the taxes have been going up on alcohol beverages over a period of time, we don't have any hardcore data from the Indian region to show that this is really making an impact. And I think this requires some good research studies on a long-term basis to track these changes and also to see its impact in the population. Next one. Most important one, which is very difficult to understand as well as very difficult to track, is the unrecorded alcohol. We have varieties of unrecorded alcohol available in the Indian region, which is produced in factories, which is produced at home settings, which is produced in villages, surrogate alcohol that comes through different small varieties. But this is another growing problem in the Indian region. And on and off at frequent intervals, we have the so-called hooch tragedies, which are mainly due to adulterated alcohol that is available. And when people consume this, we see mass casualties and large number of deaths that take place. From a recent review, we know that almost nearly 15-20,000 people have died in the last 6 to 8 years, up to 10 years, which is mainly due to unconsumption of adulterated alcohol or the unrecorded alcohol. Next one. This unrecorded alcohol contributes to almost 50% of the total alcohol consumed in the country, even though very precise numbers are not clearly available. And this has increased over time from nearly 1.5 liters per person to about 2.6 liters per person. Some of the major reasons as to why this becomes easily available is its low cost, ease of availability, and the cultural preference for unrecorded alcohol. It has claimed large number of lives in the last few years, uh, almost going up to 10 to 15,000 lives. Next one. So with the growing availability of alcohol, distribution of alcohol, sale of alcohol, and consumption of alcohol, influenced by a variety of practices uh, in the Indian region, we have also seen an increase in the alcohol attributable burden, especially with reference to increasing non-communicable diseases as well as injuries. In fact, alcohol contributes to most of the health conditions. We know that there are nearly 200 health conditions that are linked to alcohol, but for majority of the situations, uh, this is very difficult to identify. These are some of the estimates that are available, but we know that, especially we have done a review of drink driving in India, and we know that nearly 1/4 of the road crashes are linked to alcohol consumption. So it's a huge burden in that way, especially when it comes to some select conditions like road traffic injuries, suicide, and many other intention injuries and emerging non-communicable diseases. Next one. Uh, it's also estimated that the governments might be losing more than what they are earning through their taxes on alcohol. In fact, as early as 2004, we undertook a study where we estimated that the losses from alcohol are much higher than the revenues that are earned. So even as per the Reserve Bank of India's latest report, about 12% of the alcohol revenues contribute for the GDP of Indian states. And this is one of the major factors that needs to be remembered in terms of alcohol control measures in the Indian region. Next one. We know that there are a wide variety of social, psychological, and other economic uh, effects of alcohol that occur at the individual level, family, and at the societal level, and which range from violence and crime in the society to larger homelessness situation in the society. And the variety of social consequences have not been examined in detail, but it definitely costs the government much more when it comes to managing these problems and addressing these problems at the Indian region. For example, if you just take one issue like absenteeism at work, it contributes in a very large way because of alcohol consumption. But we don't have precise figures to quantify this at the national level. Next one. The response to the growing alcohol burden, we recently examined this across the 10 WHO strategies that have been recommended to control alcohol problems in a given area. And next one, Imran, go ahead. Uh, the leadership awareness and commitment when it comes to that, we don't have a clearly defined national alcohol control policy. And the health sector response has been more in terms of establishing rehabilitation centers, uh, delivering de-addiction programs in select parts of the country, in managing acute and chronic alcohol problems, but it has still not become a part of the primary healthcare system where we are able to address alcohol related problems at an early stage, nor undertake promotion activities that minimize the use of alcohol. The community actions are mainly through the NGOs, civil society organizations, and they're all isolated, they are islands of excellence, but scalability is a major problem when it comes to larger effects. Drink driving policies, India has one of the substantially good legislative measure when it comes to addressing drink driving. The Indian Motor Vehicles Act that was amended in 2018 has come up with very stiff penalties for those who drive under the influence of alcohol. But the problem is its large-scale implementation across the Indian states. The penalty levels have been increased substantially, and if fully implemented, we are very confident that this is going to yield very positive results. The availability of alcohol, though regulated, but everyone acknowledges that it's very easily available within the community for the entire population. Next one. The marketing of alcohol beverages, even though there were many traditional methods, the recent innovative strategies, the control of these are very minimal given the lax regulations that are existing. India's alcohol taxation and pricing policy are inadequate in reducing the alcohol burden. Even though this is claimed to be one of the major interventions that have been proposed and tested across the globe, in India it is yet to be really evaluated. Negative consequences of drinking are not really monitored or evaluated. There are the public health impact of unrecorded alcohol is a very challenging situation, and we don't have any systematic monitoring systems either through surveillance or through registries or through other mechanisms. Recently, we have had a few national surveys that have tried to look at the prevalence of alcohol use and to some extent its impact on people's lives, but that's not adequate to give us a real information on these things. Next one. So it's a quick tour of what's happening in India with regard to alcohol. Uh, but what I would like to summarize is basically over the last 3 decades, because of the liberalized economic policies of the government, because of the greater manufacturing of alcohol in the country, as well as import of alcohol, alcohol is easily available to the population, and that has increased consumption, and that has increased the harmful effects of alcohol from a public health perspective. There are some recent developments that have shown very positive, and if implemented will yield definite long-term results. One with particular reference to is the Indian Motor Vehicles Act that has been revised in recent times. But the remaining other policies, even though we have several regulations, the implementation has been the biggest challenging issue. Undoubtedly, alcohol consumption and its harm is increasing in India. It's a major challenge because of several factors. And I would just like to highlight 3 factors. One is, how do we replace the revenues from alcohol at the state level, which is one of the major factor. And at the same time, we have the liberalized attitudes that are growing in the society, which is favoring more consumption. And at the same time, the different methods that are being used to promote alcohol in the Indian society, which increases the consumption. So that's in brief of what's happening about alcohol in India. And thank you very much.
Thank you so much, Dr. Guraj. This was absolutely very interesting presentation. It is quite clear that alcohol consumption is a big problem in India, and you mentioned very good 3 factors at the end of your presentation, both revenues and then cultural acceptance, as well as alcohol industry involvement in all of this. So it would be really interesting just to hear more later after Amanda's presentation. What are your thoughts about this? And we have some very good questions from the participants. Thank you. Now let me introduce our second speaker for today's webinar, Dr. Amanda Kong, Cancer Health Disparities Training Program postdoctoral trainee at the Gilling School of Global Public Health, University of North Carolina at Chapel Hill. Dr. Kong's research focuses on tobacco control policies and their potential to ameliorate or exacerbate racial, ethnic, and socioeconomic health inequities In her research, Dr. Kong applies health geography perspectives and geospatial methodologies to track and investigate disparities in the built and lived environment. Her research aims to understand whether and how tobacco and alcohol retailer environments may impact health behaviors, outcomes, and inequities. Dr. Kong will speak about neighborhood disparities in the availability and marketing of little cigars and cigarillos. Dr. Kong, please.
Great, thank you so much, and thank you for having me. I just want to double check, can everybody see the screen okay? Okay. Great. So today I will be talking about a case study in the United States looking at neighborhood disparities and the availability and marketing of little cigars and cigarillos. Before I start, I do just want to acknowledge my co-authors here at UNC and also our funders, the National Cancer Institute. So just to begin and give a little bit of background, it was not until 2016 that the Food and Drug Administration, or the FDA, extended their authority to regulate all other tobacco products, including cigars. So up until this point, the FDA's regulatory authority was limited to cigarettes and to smokeless tobacco. And so here we can see that the FDA defines a cigar as a roll of tobacco wrapped in leaf tobacco, or in a substance that contains tobacco. And in this photo, we can see that there are different types of cigars. So we have little cigars that are a lot like cigarettes, and then some larger ones called cigarillos, and then a large cigar here. And because cigars have not been regulated as extensively as cigarettes and smokeless, they typically have lower taxation and also just cheaper prices because they can be sold in smaller package sizes. So typically little cigars will be sold in packs of 20, which is similar to cigarettes, which is a requirement here in the US. And then cigarillos could be in packs of 2 or 3, and large cigars are typically sold on their own. So inherently, because they can be sold in smaller package sizes and that's not regulated by the federal government, they're just cheaper. And so they might appeal more to price sensitive consumers. And then I think another important thing to note is that while you cannot purchase flavored cigarettes in the US except for menthol, there are no prohibitions at the federal level on flavored cigar availability. And that's important. We know that flavored combustible tobacco products hide the taste of tobacco, they reduce the harshness of smoke, and together this makes these products easier to inhale. And then we have researchers who have looked at one secret tobacco industry documents where the industry has talked about specifically that flavored little cigars and cigarillos, or what I'll call LCCs throughout the presentation, were designed to increase new user appeal. So thinking about youth or people who haven't yet started smoking. And we also know from these industry documents that menthol LCCs were marketed specifically to young adult Black smokers. So what does cigar use look like in the US? Between 2012 and 2016, we actually saw that the per capita cigar unit sales increased by about 29%. And this was primarily driven actually by an increase in the sale of cigarillos. So that one specific type of cigar. Current cigar use in the US, about 4% of adults, about 2% of middle school students use cigars, and about 8% of high school students use cigars. And then we do see that flavored cigar use is most popular among both youth and young adults. And there are patterns by demographic characteristics and who is more likely to use these products. So we see higher cigar prevalence among males, among younger adults, among non-Hispanic Black individuals, those with lower education, as well as those with lower socioeconomic status. So next, I'll just go over some of the methods of this study. So the overall study goals and purpose were to, one, document the overall availability and presence of advertising, promotions, and youth appeal of LCCs in the US, and to also investigate whether there were neighborhood level, racial, ethnic, and income disparities in LCC availability and marketing. Our study sample included 97 counties across the US, and we built a list of a nationally representative sample of cigarette retailers. So this was about 2,000 retailers, and this study was just a cross-section of our data in 2015. To give a little bit of context of what cigarette retailers look like in the US, our most common ones in this sample were convenience stores, supermarkets and grocery stores, and beer and wine and liquor stores. Methods-wise, I use general estimating equations, which basically are just going to account for the fact that we have cigarette retailers that are nested or reside and are located within the same county. Our independent variables were measured at the census tract level, or what I'll probably call a neighborhood throughout the study. Census tracts in the US typically range from about 1,000 to 8,000 people and average around 4,000 people in one of them. The variables here at the neighborhood or tract level were the percent of non-Hispanic, Black, or African American residents, the percent of Hispanic or Latino residents, the median household income of the tract, and then we also looked at the percent of school-age children in the tract, which we defined as 5 to 17 years old. And for all of these variables, they're continuous, so I quartiled them throughout so that you have an equal number of, or about an equal number of cigarette retailers in each quartile. Our outcome variables related to LCCs were whether there was flavored little cigar and cigarillo availability, whether there was any exterior advertising, whether there were any price promotions, and whether there was any youth appeal. And I'll get into a little more detail on that in the next slide. So for the results, I'll start with reporting the weighted prevalence of these LCC characteristics. So we can see that nearly all retailers sold little cigars and cigarillos. That was at around 90%. And 83% sold flavored LCCs. And then we also see that about a fifth of retailers had exterior LCC advertising. Next, we look at interior price promotions, and we see that a special price on more than one product was the most common type of promotion. And so an example of that would be buy 3 cigarillos, get 50 cents off. And together we created a variable just called any price promotion and found that about 18% of retailers had some type of LCC price promotion. We also looked at a few variables related to youth appeal. So whether there was an LCC ad within 3 feet of the floor, thinking about what's the eye level of a child. We also looked at whether there was an LCC product within 12 inches of youth-oriented products. So thinking about were there products placed near candy, near slushies, near toys. And then we also looked at self-service displays. So was there a product that was in a type of display or counter where a child could just go up and grab that product? And then together again created an overall variable called any youth appeal. And we saw that there was some type of LCC youth appeal in about 20% of stores. So next I'm going to go through some of the model results, and these results are all adjusted. So all the different demographics that I talked about earlier were all entered into the same model. So first let's look at flavored LCC availability. So here we're looking at non-Hispanic, Black, and the tract level. And again, I mentioned I quartiled these. So the way to think about this is retailers in quartile 1 were located in neighborhoods or tracts with the lowest percent of non-Hispanic Black residents. And I'm treating that as a reference group here. Whereas in quartile 4, we have retailers located in neighborhoods with the highest percent of non-Hispanic Black residents. I'm going to present odds ratios here, which those association sizes are going to be on the bottom. And we have a dashed line at 1. What to pay attention to here is if anything crosses this dashed line, it means it was not a statistically significant result. If anything is on the left of the dashed line, this means there was a lower likelihood of flavored LCC availability. And if anything falls to the right, it means there's a higher availability. So here what we see is are the different quartiles, and we see one significant result. And the way to think about this and interpret this is that retailers located in neighborhoods with the highest percent of non-Hispanic Black residents or in quartile 4 had a little over 2 times the odds of selling flavored LCC as compared to those retailers located in neighborhoods with the lowest percent of Black residents. Looking at median household income, we see a disparity throughout where all lower income quartiles had a higher odds or a higher likelihood of selling flavored LCC as compared to retailers in the highest income neighborhoods. And then we did not see significant associations for Hispanic or Latino or for a percent youth variable. Next, let's look at whether there was any exterior LCC advertising. Here again, we see a disparity where those retailers located in neighborhoods with the highest proportion of Black residents had almost 3 times the odds of having exterior LCC advertising as compared to those in quartile 1. For median household income, we only see one disparity here, which is those retailers located in the lowest income or the poorest neighborhoods had a slightly higher odds of having advertising as compared to those in the highest income neighborhoods. For Hispanic or Latino, we actually see a potential protective effect here, where retailers located in neighborhoods with the highest percent of Hispanic or Latino residents actually had a lower odds of having advertising as compared to quartile 1. And then no significant findings here for percent youth. Next, we'll look at whether there were any types of price promotions on LCCs. And here we see a significant association again, like the other variables, where those retailers in neighborhoods with the highest proportion of non-Hispanic Black residents had a higher odds of having price promotions on little cigars and cigarillos. But we didn't find any other significant associations for the other variables. And then our last category here, again, was whether there was any LCC appeal in terms of placement or marketing. And we find, again, a disparity for percent Hispanic Black and looking at quartile 4, having a higher odds of youth appeal as compared to quartile 1. For median household income, we see a disparity throughout again, where all lower income quartiles had a higher odds of having some type of youth appeal as compared to those retailers in the highest income neighborhoods. And for percent youth, we do see a small association here where those retailers located in neighborhoods with a higher percentage of youth just for quartile 2 as compared to quartile 1 had a slightly higher odds of having youth appeal. And then no significant findings for a percent Hispanic or Latino. So I just want to go over just a few key takeaways and future directions for this work. So we see from here that disparities are widespread. Up until this study was done, and again, our data were in 2015, there were no national samples looking at this. There had been a few studies that were local, looking at places like in DC and in Los Angeles that were finding some disparities with LCC marketing availability, but no national studies at this point, as most studies have been focused on cigarettes and their marketing. And we do see that LCC availability and marketing is more likely in neighborhoods with a greater proportion of lower income or non-Hispanic Black individuals. And so we didn't see much with that percent youth variable. I think it's important to note that youth living in lower income neighborhoods and those with a greater proportion of Black residents might be at an increased risk of LCC marketing exposure. And I think that's important to think about, especially given tobacco industry documents that have shown they're trying to target these younger populations. For future research, I think we really should think about separating out little cigars from cigarillos. If you remember that photo from earlier in the presentation, they're different products. And we've seen that the sales in these products are differing, and also the demographic and the user characteristics of the products are different. So we should really think about maybe separating them out to really get better surveillance. And then the last note I'll make is our study did not look at concept flavors. So our study captured things like if a little cigar cigarillo was cherry or it was grape flavored, a very obvious flavor, but the industry has kind of innovated as more jurisdictions have banned flavors to create something called concept flavors. So things like sweet or jazz. And we need to be pretty mindful of, as we're implementing and policymakers are implementing flavor bans to look out for these concept flavors and to really pay attention to them to make sure we're capturing some of the innovation that might be happening in response. And that is all that I have, and I look forward to the discussion. Thank you.
Thank you so much, Amanda. This was absolutely great presentation and very timely. And it again shows how tobacco industry is continually innovating in their products, not only products, their packaging, development of new products, calling different names, as well as through their tactics, which is marketing, advertising, and appealing to different populations by this exacerbating the disparities already so deeply integrated in the American culture. So I was wondering whether there was any data, if you had any information about specifically about LCCs and women appeal, how it is with women or with minority people, and what do you think will be the best way of coping with this? It is clear that the industry innovation is going on faster than policy responses. It seems that the policy responses and different interventions are not catching up with all these innovations. What do you think would be the best way of addressing this issue?
Yeah, I mean, I think we definitely need to have more surveillance of what's being sold. So I think a lot of times the industry is ahead of us, as you noted. And public health, I think a lot of times we're responding to what we see that the industry is doing. And so I think continued retail audits of whether it's online purchasing, which I think we're seeing a lot more now with COVID, but doing more surveillance of what is being sold and marketed to consumers in the retail environment is important, and that we keep that surveillance up so that we're not just responding to, oh, we've seen a spike, for example, in e-cigarette use over the last few years, but that was something I don't think a lot of people were actually surveilling in the marketplace until we started seeing a lot of youth use. So I think it's continued surveillance of the different points of sale that we think the industry is using.
Thank you so much. Dr. Gururaj, from your presentation, I'm going to ask you, there were a lot of questions, and I'm going to ask you, just try to ask you a few of them. It is quite clear that if without effective measures, alcohol consumption availability is on a huge spike in India, and both among men, women, but also among adolescents and youth. So given this large number of young people, I think it is urgently needed to have some targeted interventions or policy measures. So you mentioned that there are some age restrictions, but is marketing of alcohol to young people ages under 18 or 25 or average age of 21, as you said, is there such a law for prohibiting marketing specifically for this population?
Yeah, there are regulations that prohibit the sale of alcohol to minors, to less than those who are less than 18 years. But the challenge is in implementing that. The law is there, and even that law varies across Indian states. As I mentioned in my presentation, there are states which are at 18 years. There are states that have specified 25 years. So it varies from state to state, and that's one of the biggest challenges, because if there is no uniformity in putting these regulations into practice, then it becomes very difficult. So the law exists, but implementation is a challenge.
Of course, that is very clear. So what do you think would be the urgent data need for assessing the impact of alcohol industry tactics in India? And have you been able to get such data?
No, we don't have any such data. Especially, we have not seen the impact of these promotional strategies on the young population. Of course, it has been studied in the area of tobacco use. Quite extensively it has been studied, and there are now regulations which specifically address this problem. But when it comes to alcohol, we have not seen the clear data that shows how these promotions and endorsements, advertisements have an effect on the young population. We definitely need more research in this area to look at it both from a quantitative and a qualitative perspective.
Of course. And you also mentioned the problem of unrecorded alcohol consumption. Uh, what would be the best way of addressing this problem, and what actions are taken by the government to regulate production and even availability of such dangerous drinks in India?
Oh, there are a lot of measures that have been taken, and again, there are some places where it has worked very well. For example, the closure of places where unrecorded alcohol is manufactured, to imposing heavy taxes, to raiding these places and destroying them sometimes, to confiscating the unrecorded alcohol that is available, imposing huge taxes in some places. So all these are some of the efforts that are there, but it still continues.
Okay, thank you so much. Amanda, a question to you. So what laws can curtail exterior LCC advertising? What is the evidence base for such policies? Can you share some insights about this?
Yeah, so again, a lot of the research has been done in terms of just overall tobacco marketing or cigarette marketing, and not so much specifically LCC. But what we do see is that exposure to point of sale marketing is associated with smoking behavior. So initiation among youth, cravings for people who might have quit smoking or are trying to quit smoking, and relapse behavior. So we do know that there's pretty good evidence that exposure to marketing affects smoking behaviors. In the US context, it's really, really difficult to try to regulate advertising of any sort because of the Constitution. And so I think the best way to get around that is to try to reduce the number of tobacco retailers, because theoretically, if you stop selling the product, hopefully you will then have less marketing. And so I think one of the main policies that could be done is to think about licensing. And I know this is a thing for alcohol as well. And we really need to set up a licensing system so that you can know where these retailers are in the first place, and where are they selling tobacco, where are they selling alcohol. And if there are violations, such as a retailer keeps selling to youth, for example, then there's a way to take away that license. And to charge fees for licensing can deter some retailers from wanting to sell these products. And as retailers make more violations, what you'll commonly hear in some of the literature is this type of cap and winnow approach, where as violations are made, retailers will just start kind of winnowing down on their own. And I think that is a way to get at advertising. Another example, if you're talking about youth, is to think about, we are able to think about reducing the number of retailers near schools. And so that's one way. If you implement a retailer reduction strategy, such as not allowing retailers within 1,000 feet of a school, that would be one way that you would think advertising would go down without actually regulating the advertising and likely facing industry pushback and lawsuits. So I think licensing and thinking about actually taking out the product from retailers is one way to get at that.
Thank you. Great. So we're almost running out of time. We have 3 minutes left, and I would like to ask both of you to maybe perhaps briefly answer one like very typical question for today's reality. So Dr. Gururaj, are there any changes in alcohol availability and consumption in India during the COVID-19 pandemic?
Oh, that's a very interesting question. Since the beginning of the pandemic in the month of, early March, the country underwent a lockdown beginning on March 24th. And it then persisted for quite some time. And during this time, we had variety of issues with the alcohol problem. Firstly, alcohol became non-available. And then that led to, in some places, I mean, we don't have any clear information, but at least anecdotal media reports indicate that there was some amount of sale of alcohol that was continuing to happen. But at the same time, people with alcohol dependence problems had major difficulty in getting their treatment, and many went into withdrawal. So we saw both ends of the spectrum. Uh, and then the lockdown continued, and then alcohol shops were closed for quite some time. And this led to some type of a heated debate and arguments, as well as some turmoil, and which sort of ultimately the pressures started coming up on the government to open up alcohol outlets. This also happened because of one other reason, where the state governments ran out of their revenues. So because alcohol, like I said in my presentation, is a major source of revenue. So for some, it affected very badly. And at the same time, there was also a, a health perspective that was also brought into this, uh, that people are also, getting affected because of other reasons. So in the middle of all this, one thing that happened was there was a sudden increase in the taxes on alcohol. And again, this was not a uniform move. It varied from state to state, and some states imposed very high taxes, almost about 100% rise. And then there was a time which came when there was a phased opening of the alcohol outlets. And this led to such an amount of commotion. It's available in the public media that there was a huge rush for buying alcohol. The precautionary and safety measures of COVID-19 were ignored, and there were huge, such a high demand for alcohol purchase. And all this led to even some of the states allowing for e-commerce of alcohol. It was such a change that started happening. And over the unlock period, it started slowly opening up in a phased manner. And now most of the alcohol shops are open. It's available to everyone. But the point is that when there was a lockdown, there was a demand from the public that alcohol should be available. At least some sections of the society were demanding for it. uh, there was also a pressure to open it up from the economic point of view, because it's one of the important revenues. And thirdly, there was also a health perspective that came in. Because of all these combined factors, slow unlocking and reopening of the alcohol shops started happening, and that led to regular purchase. So in fact, it's a very interesting situation,
It
especially to
is.
look at the alcohol availability during COVID times.
I agree with you, Dr. Guraj. It seems like this is going to be, if somebody's going to take on this is going to be a very interesting case study, just to look at the all these changes in detail, what happened during the six months of the COVID pandemic, especially in India, and alcohol availability and consumption. Thank you so much. Amanda, do you want to reflect just briefly if you have any information about any changes in terms of availability or consumption of either cigarettes or LCCs in the United States during the 6 months period of COVID-19?
Yeah, I'll just briefly note, in terms of thinking about cigarettes and smoking, what a lot of us are thinking about in the field is, I think similar to alcohol, is did people just stock up all of a sudden in the panic when things started shutting down with cigarettes? And if you have a larger supply in your house, could that increase consumption? Because now you just have a whole closet full of cigarettes, or many cartons of cigarettes, and so you're more likely to use because it's there. I think we also have to think about stress. And if stress is contributing to people who are smoking more or more frequently. And then I think the other big thing to think about is just, if people are stressed out and they're having a bigger supply, this might lead to more consumption. And also, we have a lot of workplace protections where you're not allowed to smoke at work. And as people are shifting to remote work or potentially losing jobs, have those protections that are now kind of temporarily removed, or maybe long-term removed now that we're so far in the pandemic, is that leading to increased consumption and smoking? And so I think thinking through all those factors and that policy aspect of workplace protections, whether that's contributing to increased smoking consumption is something we're going to need to evaluate and pay attention to.
Absolutely, fantastic point, and I completely agree with you. We are out of our time. I'm going to start and wind it down, but I would like to thank you, both of you, for such wonderful presentations. Thank you all participants for being part of this webinar and asking such interesting questions. I think it's very clear that there is still a lot of work that needs to be done in the area of commercial determinants of health in terms of both alcohol as well as tobacco. And we do see a lot of similarities in the tactics of these two industries in two different settings, in high income, in developed and developing nation. So I think this is a time when everybody should be much more focused and much more determined in studying deeply and understanding what can be done, what are the best approaches for addressing these issues. Thank you everyone again. I would like to thank our staff members who are working behind the scenes to make this happen. Thank you so much, Ben. Thank you so much, Imran, for all your hard work. And again, thank you, Dr. Gururaj and Amanda. Have all nice day, evening, and stay safe.
Thanks, Dr. Nino, and thanks everybody for joining this webinar.
Thank you, everyone.